That was the Premier at his press conference yesterday, warning all of us to brace for impact as the province faces a tsunami of new COVID-19 cases. The return to in-person learning has been delayed by 2 weeks for students. The province is bringing back capacity restrictions, and non-emergency surgeries have been canceled to save precious hospital resources.
Can these measures blunt the impact of COVID-19? How do we get kids back in the classrooms for good? And how do we ease the pressure on our hospitals? Joining us tonight is Dr. Sharkawy, infectious diseases specialist with the University Health Network, Dr. Martin Betts, chief of critical care at Scarborough Health Network, and Deonandan, an epidemiologist and associate professor at the University of Ottawa. Thanks so much for joining us. Happy New Year to all of you. Dr. Sharkawy, we'll begin with you. You know, so much has been said about the Ford government's approach. Was there a way to avoid this? Where did Ontario go wrong?
Boy, I don't know where to begin. I think the issue is, when did we decide that we were going to become more proactive about this, and when should that have started? The concept that somehow Omicron snuck up on us and that numbers had skyrocketed over the weekend is just difficult to digest for most Ontarians. We've known now for several weeks what the exponential trajectory of this variant was going to be. We knew that irrespective of whether it was mild or more severe in terms of the type of disease that it was going to cause, that the rapidity of spread by itself was going to be very, very problematic. So, while I'm somewhat heartened by the idea that we are doing some things to try and limit the spread, and unfortunately school closures have become part of that equation, what I'm really worried about is that these blunt instruments do not really address the root cause of the problem. The major issue here is finding ways to help people manage this outside of the hospital, to prevent transmission in ways that don't require access to healthcare resources, and being able to do things in a household and on a family basis that's going to be able to manage this. And that hasn't been done here. It's very worrisome. If everybody decided right now that they would stay in their own home and not move for the next week, that still would not address the problem. So a 2-week school closure, for example, is not going to address this. It's going to slow things down very little. What we need is true safety measures. Are we going to provide more effective masks for everybody going into these school environments and in every essential work environment? Is there going to be expanded eligibility and mobilization of booster vaccine clinics for every age group, particularly kids and education staff? Those are the things that we need, in addition to mobilization of oral therapies and discussions with Health Canada and other stakeholders to help do things that are going to help people stay out of hospital if they start to exhibit symptoms of COVID-19, and not wait until a bottleneck crushes our system, because I'm really quite worried that that's what we're looking at over the next 10 to 14 days.
And on the eve of these new restrictions coming in, or what we're familiar with stage 2, hindsight is taking us back a few weeks, right, to December 16th. Dr. Betts, the science advisory table back then was projecting if Omicron was going to be as severe as Delta, ICU capacity would be reaching limits that we hadn't seen before. The ICU capacity is not reaching that yet, but should that have been the only measure? Should we have been looking at the daily case counts when considering the spread of Omicron?
I think you bring up a good point. We talked, I think, around that time about what the impact was likely to be on the health system, and we knew at that point in time that the case, and particularly the rate of case growth, was going to lead us to a position where we're seeing 10,000 cases a day by New Year's, and that the impact on the health system was going to be delayed. That ICU is one thing. I think certainly we're seeing in this wave that hasn't hit the ICU to the same degree that it has in recent waves, but I think it's still early, and certainly myself and my colleagues are seeing the number of patients with critical illness come and increase faster every day that we've worked. At the moment, we're seeing real challenges in the hospital sector, so in the medical wards and surgical wards, and getting essential care provided for those patients. And then the other piece I think that's lost if we don't start to track cases is this notion of long COVID and patients with prolonged illness, that more cases you have, the more people will be exposed to that, and that'll play a big impact not only on the health system, but on productivity and quality of life for these individuals in the months and years to come.
Ray Watt, can we talk about the timing of this decision? If these measures, if moderate measures, let's say, were introduced before the holidays, would we be in a different position today?
I think we would, depending upon the degree of compliance people had with those measures. But what measures are we talking about here? The same ones we're always talking about. HEPA filters for schools, N95 masks for students and workers, mandating vaccines for educational workers, making boosters more available for everybody, and fixing the equity issue across all of society. Who gets access to N95s and rapid tests and HEPA filters? The wealthy in general. So there are a lot we can do still that we have to do. And I've been saying for a long time, we have to be mandating paid sick days to disincentivize people from going to work sick and changing the SOPs so that people aren't encouraged to be exposing themselves to others when they're symptomatic.
I wonder about that, Ray Watt. Are we taking workplace outbreaks seriously enough when we're trying to address the spread? We talked about hotspots by postal codes maybe this time last year. What about workplaces and looking at the data collected over the last 2 years on where these outbreaks are happening in our communities?
That's always useful. Now, because contact tracing is kind of broken, that data is not entirely reliable, but it's still useful. And frankly, I'm a little worried about the isolation SOPs as well. We have stories of people saying they can get back to work after 5 days of a positive test, even if they're symptomatic, which to me is insane. So we have to address these SOPs. We have to deploy our limited testing capacity more strategically. We have to make workplaces safe. We have to disincentivize people exposing themselves to others when they're symptomatic and infected. So again, there are many things the state, the government can still do, and many things that we as individuals can still do to help curtail this problem.
Dr. Sharkawy, schools are closed to in-person learning for at least 2 weeks. Not what a lot of parents wanted to hear, but here we are. How do we make the most of these 2 weeks so when kids do go back to the classroom, it's safe?
Well, listen, I can tell you as a parent of 3 school-aged children myself who have really suffered from the brunt of online learning and what that means. And I say this knowing that I have much more privilege than a lot of people who don't have much in the way of means. We're talking about single mothers who are working 2 jobs to try and maintain a household, for example, for their children. We have to recognize that simply closing schools in and of themselves is not good enough. In fact, that would be a huge offense to those very same people who are struggling with those inequities. We've got to do those things that are going to fundamentally change the safety infrastructure in school environments. That means a mass provision of more effective masks. We're talking about daycares here as well. Let's not forget daycare staff are dealing with effectively an entirely ineligible, unvaccinated cohort of young children that they're looking after. We've got to address those points. We've got to make vaccination more widely available to these people, to make it a priority for them, to make rapid tests available. And, this has been a hot button issue for a while. They're not perfect. Well, they are fraught with these problems and not. Listen, nothing is perfect in a pandemic, but perfection is the enemy of progress. What we really have to do is give people as many tools as possible, provide them with the education as to how to use those tools, and make sure they're equitably distributed. If we do all of those things over the next 2 weeks, then hey, maybe closing schools for a short period of time is quote unquote worth it, if I can use the term loosely. If we don't, I think that this is going to be a really, really damaging situation in terms of public trust. And I can tell you that it's not going to sit well with a lot of people, including parents.
And those single mothers you talk about, Dr. Sharkawy, they work in hospitals and ICU. Dr. Betts, how worried are you about staffing issues as schools remain closed?
Absolutely. And I think you could even make the case that schools being closed puts a heavier burden on many of our nursing and physician staff that now have, new childcare responsibilities that they didn't anticipate having coming into this week. I think as other hospital systems, as ours has encountered over the last couple of weeks, we see increasingly staff off work because of being sick, primarily with COVID, having family members sick, or even on isolation. Now, we've got some new tools to get people back to work a little bit sooner, but we have seen through the hospital sector, for instance, at William Osler in the last couple of days, that not only staffing the emergency departments and medical wards is a great challenge, But as many would know, on the same day, they had a real crisis with their EMS system and having available ambulances to respond to 911 calls. And so from the very beginning of your hospital journey of calling an ambulance to the end stage of getting into rehab and getting back into community care, we are struggling, and we anticipate that given the breadth of this outbreak, we'll continue that for the series of weeks.
Ray Watt, I think everybody in Ontario knows somebody who is infected. I want to ask you, is Omicron our path to herd immunity?
That's a dangerous question, and I don't have an answer for that, except to say it's pretty clear that the great majority of people are going to be exposed very, very soon. Now, exposure does not mean infection, and infection does not mean symptoms, but it's going to wash over this population like a tsunami, and it's going to leave in its wake, for many people, the gift of immunity. Is that immunity durable? We don't know. Is it a strong immunity? We don't know. Will it protect us against future variants? We don't know. I think there's a good chance. And if I were a betting man, I'd say a combination of infection and recovery plus vaccination puts us in good stead by the spring to prevent possibly future waves. Don't quote me on that, because new variants could always change the situation dramatically. But I like to look for a silver lining in things, and that might be the one great silver lining we could hope for. But again, this disease has a way of throwing us curves every week, so let's not make too many predictions we can't hold to.
Yeah, an unprecedented situation for sure. Ray Watt, Deonandan, Dr. Martin Betts, and Dr. Abdu Sharkawy, thank you so much for your expertise. We certainly appreciate your conversation tonight.
Thank you.
Thank you.